We often don't appreciate things until we lose them. That is exactly how I felt when I was without my family practice. My better half, Umberto, was diagnosed with stage 4 cancer, and for 14 months I provided him with 24/7 care. It was my longest interruption in the 27 years that I had spent as a family physician. Sitting with Umberto at the clinic one day, I realized how much I missed the incredibly rewarding feeling of listening to people's stories and making a correct diagnosis. Synthesizing information from the patient and physical assessments, and then ordering a diagnostic test to confirm my suspicions. Solving these clinical riddles on a daily basis was what made family medicine endlessly interesting. And lots had changed in my time. Recommendations around cancer screening practices like regular PSA testing, mammograms, colonoscopies had changed as the evidence evolved. I had supported many patients as they received a cancer diagnosis over the years. I remembered the waitress in her 50s who had spent 25 years exposed to secondhand smoke. That was an easier diagnosis to make. But then there was the woman in her 40s who had never smoked, nor been exposed to secondhand smoke. I remember asking her, "Have you ever smoked? And then, are you sure?" I didn't mean to doubt her, but it just didn't fit with what I thought I knew. I'm glad that I kept asking questions until I learned about potential radon exposure. Based on this information, I sent her for blood work and an X-ray because I knew her. When she said something didn't feel right, it was not right until proven otherwise. Those tests meant she had the opportunity to receive treatment and have a better quality of life. My training had always emphasized the link between smoking and lung cancer. But many people today with lung cancer have never smoked. I looked over at Umberto sitting next to me. He didn't have healthcare coverage in Canada, so I remember paying for his chest X-ray. It was only $20 and exposed him to about the amount of background radiation we receive over a 10-day period. I was glad that his family doctor had recommended further testing when Umberto had suspicious symptoms. Yes, things constantly change in family medicine, and always learning new information could help me solve clinical riddles now and in the future.